You've seen the astonishing weight loss results Hollywood stars and normal people are getting with Ozempic. But I bet you've heard the horror stories about the side effects too, and maybe you're worried the same thing could happen to you. It doesn't have to be like this. My name's Sarah, and at SummaUp, we've helped more than 100,000 people to achieve sustainable weight loss. In this video, I'm going to explain clear, actionable steps you can take to minimize the side effects of Ozempic so you can make the best informed choice to finally achieve your weight loss goals. And it all starts with understanding what Ozempic does to your body in the first place. You probably know Ozempic is just one of a class of drugs called glucagon-like peptide 1 or GLP-1 agonists. This simply means they do the same job as a hormone naturally produced in the body. That hormone is released after we eat and has various effects, including slowing down the emptying of your stomach, increasing insulin to lower blood sugar levels, and acting on the brain's appetite centers to reduce hunger. It's important to remember these are all naturally occurring processes because the tips I'm going to share with you to reduce the side effects of Ozempic are all going to work in line with these natural processes. By far, the most commonly reported side effect of Ozempic is nausea and vomiting. Think about that for a second. If you've eaten a really big meal, your stomach is really full. How do you react to the sight of food? You probably feel so nauseated by the sight and smell of food, you want to turn away from it. It might even make you feel like vomiting. Well, given that Ozempic is effectively tricking your body and brain into thinking it's fuller than it really is, it's no surprise that people have the same reaction when they take it. If anything, feeling nauseous and or vomiting after taking Ozempic is a sign that it's working. But I understand that's scant relief when you're suffering the discomfort. So how do you avoid this side effect? The Japanese have an expression, 𝐻𝐤𝐴𝐺𝐻, which roughly translates into English as eat until you're 80% full. This is good advice for anyone, but particularly for folks taking Ozempic. Simply eating smaller meals up to 50% less than usual will reduce the feelings of nausea and vomiting in the same way that eating smaller meals would stop you from feeling unpleasantly full. But won't I get hungry, I hear you ask? Maybe, but you can always eat a little more if necessary. What you can't do is uneat anything. What you're likely to find when taking Ozempic is that less food than normal leaves you feeling full, so you won't want to eat your normal amounts of food anyway. Apart from eating less, slowing down at mealtime is a great idea too. It typically takes 15 to 20 minutes for the stomach to let the brain know it's full. Taking at least this amount of time to eat your meals may result in you feeling fuller sooner and not overeating. If you have the habit of eating alone, watching TV, or looking at your phone while you're eating, you'll probably eat quicker than you realize. Where possible, take the time to sit down for a meal, enjoy the company of family, friends, or coworkers, and make it truly a social occasion. 20 minutes, they'll pass in no time. The second most frequent side effect of Ozempic is diarrhea. To an extent, eating less and eating more slowly might help with this side effect too. But what else can you do? You could try over-the-counter treatments like Imodium, but one really effective supplement for preventing diarrhea is psyllium husk. This high level of soluble fiber in psyllium husk, up to 80%, has the effect of absorbing water and aiding transit through the bowels. Both of these effects will reduce symptoms of diarrhea. At the other end of the scale, some patients taking Ozempic report experiencing constipation. Drinking more water will help with constipation and with weight loss in general, as you'll feel fuller after drinking. Walking is also great for relieving symptoms of constipation. And of course, walking is excellent exercise for everyone. It's the simplest form of cardio. It burns calories and it'll make you feel great. However, if neither of these treatments help, psyllium husk can come to our aid again. That high proportion of dietary fiber will get things moving if water and walking aren't helping. The most important thing to know about all of these side effects, nausea, vomiting, gastric distress, and constipation, is that they are all symptoms of adaptation. In other words, you may suffer from them when you start taking Ozempic, but as your body adapts to its new normal, they should reduce until you increase your dosage, when you might find they return. After which, they'll get better again, and so on. This means it makes sense to start Ozempic on the lowest dose available. Unfortunately, with the massive demand for this medication, it can be hard to find the lowest dose, and so many people are forced to start taking it at higher doses, which results in them experiencing worse side effects. And of course, when people see they're losing weight on those higher doses, despite the side effects, they're tempted to increase the dose even more, and the whole thing becomes a vicious cycle. The good news is there's a better way to manage these side effects, which I'll share with you in just a second. However, none of these tips will work if you don't follow the next piece of advice I'm going to give you. Taking Ozempic on a full stomach is guaranteed to worsen any side effects you do experience. Waiting 2 or 3 hours after your last meal means your stomach will be mostly empty, and so feelings of nausea should be reduced. Other people have had success taking it first thing in the morning before they have had anything to eat. In general, sugar, caffeine, dairy products, alcohol, and artificial sweeteners may all worsen the side effects you experience on Ozempic, although this may vary from person to person. You'll probably need to do some trial and error to work out what works best for you. Keeping a symptoms diary can help here. Just keep a record on your phone or in a notebook of what you eat and when and the time of day you're taking your injections and any symptoms you experience. If you do that for 1 or 2 weeks, you might start to notice some patterns about the best time to take your injections, which foods you react best or worst to, and which treatments relieve your symptoms the most. Something else people often report is sensitive skin issues around where they inject the medication. Fortunately, there are a number of injection sites you can use, including the glute, back of the arm, deltoid, the abs, the flank, and the top of the thighs. Using different injection sites will help avoid inflammation and any other sensitivity you might otherwise experience. Most of these side effects are temporary. They'll certainly disappear if you stop taking the medication. On the other hand, there's one well-known consequence of Ozempic that has to be planned for before you start taking it if you want to avoid it. Ozempic face is the hollowed out look of some people's faces when they take the drug. It results from a loss of muscle and bone rather than fat and is much easier to prevent than to treat. We can take a lesson from bodybuilders here. Gym goers know if they want to build muscle, they need to do 2 things: lift weights and consume more protein. And that's exactly what you should be doing to avoid Ozempic face. Increased protein consumption from lean chicken, turkey, fish, and legumes will help build muscle as long as you're doing some form of resistance training. Bodyweight exercises, resistant band workouts, and weights will all do the job. You don't even need to leave the house. Find a resistance workout on YouTube you can do at home and start there. Start off small and build up only when you're ready. And that's exactly the way you should be thinking about taking Ozempic or any other GLP-1 agonist. By far, the best way to minimize the side effects of any of these medications is to take them in smaller than standard doses or microdosing. What we've seen time and time again is that when our patients microdose their medications, they are spared the horrors of Ozempic face and other common side effects like stomach paralysis, uncontrollable muscle spasms, and visits to the ER. We simply don't see these side effects in our patients precisely because they're microdose the medication. The only thing is they're not using Ozempic. So to find out which medication they are using and how you can do the same thing, watch this video now.